Hello, everybody, and welcome back to today's episode of Twomey Time. I am your host, Megan, and today we have our guest, Lindsay Carr. She is a certified registered nurse anesthetist and has her doctorate of nursing practice in nurse anesthesiology from the University of South Florida. Lindsay has over a decade of nursing experience, all of it basically in the intensive care unit and the ICU. And she also has 3 years of travel nursing experience, also in the intensive care unit. So, Lindsay's joining us today really to talk about her experience as a nurse and going back to school to become a CRNA and her experience throughout the whole process. So, thanks so much for joining us, Lindsay.
Thank you. Thank you.
Woohoo. I like to usually start our episodes with like a little bit of an icebreaker. And I thought it would be fun to kind of go through maybe some common questions or misconceptions that you might get. And you can debunk them for us or tell us the right information. How's that sound?
That sounds great.
Okay, cool. Um, so, number one, I'm having surgery. That must mean that I am getting put to sleep with like general anesthesia, right? So, I'm totally going to be knocked out.
The answer to that would be so it depends on what your surgeon needs. So,
Mm,
for example, like if you're going to have a colonoscopy, we usually use what's called moderate anesthesia for that. We use just a little bit of propofol through your IV. We give you an infusion, and that helps you be able to tolerate the procedure, but it's not crossing that threshold of general anesthesia, which is what you would get with, say, a gallbladder surgery, a hernia surgery, or open heart bypass, where you are completely paralyzed, knocked out, unconscious, completely unaware of uh, of the surgery, and your body's completely unaware of the surgery.
So, always a good question to ask your anesthesia provider. And usually, I'm sure anesthesiologists go through that when
Yes.
you're consenting your patient, of course. But
Yes.
if you don't know, ask your anesthesia provider. They'll know what sedation they're using. Hopefully,
Correct.
most likely. Yeah.
Correct. They
Okay.
do.
So, number two, I often hear people say stuff like your gut is the last thing to wake up after surgery. What is going on with that? And is that true?
I feel like this has a lot to do with like the narcotics used around surgeries that are either given during the procedure or, you go home on some sort of narcotic. Um, and of course, we know that one of the side effects of narcotics is it slows down your gut motility. And so I think that's kind of where that's coming from.
Mm. Yeah,
Hmm.
constipation post op is never fun for anybody. So, gotcha.
No, stay up on the fiber, the fluids, and the senna and colace and prune juice.
Hopefully you'll be good to go. Awesome. So number three. So I'm a redhead. You can't tell because I just dyed my hair like last week. But I've
It's
heard,
gorgeous.
thank you, thank you. But I've heard I need more anesthesia than the average person. So is that true just because I'm redhead?
It is typically very, very true. They
Wow. Wow.
need usually a much higher dose than your normal population or for that same person.
Wow.
So yeah, no, it's really interesting. They've just got different keep it easy. They metabolize the anesthetics in a faster rate. So
You don't ask
we need
that, do
more.
you? Or
No, 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 not usually. I just kind of make a mental note. I'm like, oh, they've got red hair. Or
right.
say they're like white hair now, but their like child is like bright red. I'm
Right.
like,
Right.
okay, they probably are
Or if
too.
they've had anesthesia before, that's like I know you guys ask that question
Hmm.
all the time. So
Yeah, sometimes they'll say like especially they'll be like, oh yeah, just by the way, like I need more than the normal person. You'd be like, okay, no problem. Then
hmm.
you'll just grab some extra and you'll make sure you keep them deeper than somebody else.
Well, good to know.
Yeah.
And number four, is this true that if my surgery will get canceled if I have anything to drink or eat after midnight?
Food is what we really, really care about. 8 hours for food is the rule. So say your surgery isn't until like 4 p.m. the next day, it would be safe to have a small light breakfast. Okay, don't go
Okay.
ham, over things, but you'll be fine with something light, something that's easily digestible, something that your belly can tolerate. As far as fluids go, water is actually okay 2 hours, and then other fluids like
Wow.
your colored drinks like sodas or milk or things like that. That would be a 4 hour um, criteria
Time
for
frame.
us.
Wow. Well, that's good to know. And obviously, I would, I just went through surgery myself and I actually didn't know that. And I went
Yeah,
in there and they're like, you should have had some water before you came in. So I didn't even know that. And I'm in medicine. So that's really cool to hear. So
yeah.
thanks for updating us on the recommended guidelines. Um, and so, Lindsay, I'd like to talk a little bit about so for those of you who don't know, I should probably say this in the beginning, a CRNA, certified registered nurse anesthetist. Can you tell me a little bit about what is an anesthesia provider and like what do you do?
Sure. So CRNAs, we provide anesthesia care to both inpatient and outpatient settings. So we can work in, depending on the state, you can work independently for a clinic, or you can work in with like a group with other CRNAs and anesthesiologists. Just kind of depends on what kind of practice setting you're in. But we typically will deliver anesthesia, um, and it can be, we serve all types of populations. You could work with pediatrics, you can work with the OB population doing epidurals and C-sections. You can work with, doing cardiac, doing open heart, or, organ transplants, or
Mm,
say, you could work in an eye clinic or dental office and provide
mm,
anesthesia in those places. And yeah, we're everywhere.
awesome. Thanks for clarifying that. That's
Hmm.
great. So you obviously started out in the field of nursing, which I am curious to know, did you always want to be a nurse? Was this something you always thought you would end up doing for a career? Like how did you, or is this something you fell into?
When I graduated high school, I did not know what I wanted to do, but I thought like something sciency would be a good idea. And I don't know. I guess I always just I wanted something. I wanted a career where you could. I had my parents, they worked a lot, and my mom would bring her work home with her, and so I wanted a career where like work stayed at work, and when I got home,
Mm,
like they were just separate. And the more I kind of thought about what I wanted to do, I it just kind of fell into nursing, and it just made sense. I've
wow.
always had a knack for science, so.
Well, that's a good thing. You obviously needed it and use it all the time. So that's important. Did you know you wanted to go into intensive care though? Or did you figure that out after
I
school?
No, I really had no idea. I remember I graduated from nursing school and I went to my first job at a nursing school. They had this like nurse residency, which at the time 10 years ago was like a really brand new thing.
Yeah, that was a
Now
big deal back
now
then.
it's like every hospital has it, but at the time then it was like a brand new idea.
Yeah.
And you
So
remember
crazy to
that?
think about that. Yeah.
Yeah. And
I
so, because before they would just hire you onto the unit, but I got into this
yeah.
nurse residency program, and the way that this hospital worked that I was working at in Chicago, is that you would rotate between the different units. I think they had like ER, ICU, med surge, tele. They had
Wow.
they had like they had like a whole bunch of different units you could try out, and you worked along the nurses, and like you kind of ranked your pick of which floor you wanted to be on, and if you got the letters of recommendation from like those nurses you worked with, like you pretty much got the job, like whichever unit. So
That's great.
yeah,
That's great.
I was like, ICU is pretty cool.
I can't see you really anywhere else besides critical care. I mean, I probably could, but I met Lindsay when we were critical care
Yeah.
nurses, so I feel like I your personality fits it, and like you're so good with critical care. So
I just
cool. I
remember
would
being bored and like numb to the amount of tasks you have to do on the med surge floors.
yes, seriously. It's a total. It's so funny because people like nurses know to ask like, oh, what kind of nurse are you? When in reality, we're all nurses. We take care of everybody, but there is something to be said with nursing is so diverse and your fields are so different from like outpatient school nursing, even inpatient. Like people don't realize that a psychiatric unit is so different than med surg, which is different than ER and different than ICU. And they all have these little different personalities and quirks.
Yes,
Like it's cool. So
100%. Yeah.
yeah. Yeah. So did you know you wanted to travel nurse, or was that something, did you even know that travel nursing existed, or how did you like work your way towards travel nursing?
I I don't know, like my husband who I was just dating at the time, he really really wanted me to travel. And I was like interested in it, but I wasn't quite ready. And so, I applied for the license that was out of state. And then it
Hmm.
was kind of finally like, okay, I got to talk to some people, and because it's scary leaving your W-2 job in like a city you've
Totally.
lived in for a while and your comfortable job, and like just jumping in and being like, I'm gonna go work for 3 months over here and just see what
Yeah,
happens.
definitely.
Yeah, no, so it was one of those things. He was like, Lindsay, come on, like this would be really, really fun. This would be a fun adventure. So I was like, okay, I guess. Like, you only ever really grow when you push yourself in like uncomfortable positions. So
A hundred
I
percent.
grew a lot, and I did it. I chose to do it with that intention of knowing that I was gonna grow a lot during the whole process. So
True. You get like so, especially in a critical care environment where it's high stakes every day, high stress. You know your team, you know your
hmm
docs that you work with, you know the providers at the hospital, you know who to call when you need something. You just know the flow, and you don't realize how much knowing that flow and understanding it just takes the stress, like a lot of stress away, because you just have trust. Not that you don't have trust when you walk into another hospital, but it's they don't trust,
there's a
you
lot
have
to
to build
learn.
that trust.
Yeah,
Yeah, and there's a lot to learn.
yeah,
And
yeah.
you don't get orientation most of the time, so
No,
which
one
is
of the biggest,
crazy.
I always thought the biggest stressful part of the job, like when you would go to new places, where is stuff? Like, where do you keep
Yes.
this? Where do you keep that? Like, how do you order, like, a medication that's not available in the Pyxis? Like, how do I get it?
Mhm.
Where's
Mhm.
the phone
Who do I
list?
call? Like
Yeah.
yeah.
How do I find their number? Like, like that was, it's just like, where is stuff? And then, but like nursing is nursing everywhere.
Mhm.
They have really a lot of similar standardized protocols, and, there's different nuances to them all across like the country, but they're all fairly standardized similarly. And,
Yeah.
which makes it really, really nice. And then, you just don't be scared to ask questions of like, hey, okay, like I need to call the doc, but like how?
How?
Or
Yeah.
like, or like, should I wait till they round, or like what? Like, you just ask.
Yeah. And every like floor has its own
Mm-hmm.
like flow of doing things. But I also feel that once, I'm sure you experience this too, once you do one, two, or three or four
Yeah.
assignments, they get a little easier as they go, because it's
Yeah.
just, same thing, different place
Yeah.
almost.
Exactly. Exactly.
Yeah.
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 It was such a
Which
good
is
learn.
great.
Like, yeah, it was such a good learning, stretching all the things. You really
Did you
get really
do
flexible. Hmm.
Yeah, super flexible. Also, I feel like it's kind of cool because you have skills that maybe some of the nurses you're working with don't have, and you share some of those skills back and forth. And it pushes you because I know you were most of the time in the neuro ICU, but you did ICU float pool as well, I believe, right?
Yeah. Yeah.
For
Yeah.
a
I
period of
did a
time.
lot
Yeah.
of. I would go to all the like medical surgicals, ICUs, and done cardiac here and there too.
Yeah. Kind of fun. Did
hmm
you, is how, and then obviously, like, I feel like now once you're an ICU nurse, you know that a lot of people go on to a CRNA route of things, but was that your intention always in nursing school, or like thinking about it? When did that start becoming a thing on your radar
I
of
was
like,
just kind
maybe I
of
want to go back
getting.
to school?
I always knew I wanted to go back. I just didn't know like the timeline or what for. If it was going to be
Hmm.
NP or something different. Um, I knew it was kind of time to start looking into my options when I was kind of getting bored at work.
Yeah.
Just kind of realizing like I don't really want to do this for like the rest of ever. you
Yeah.
know, there's other things I could try. And so I started looking into my options with advancing my degree, and learn more about CRNA. Got to A family friend is a CRNA on my husband's side, and I got to shadow him and had like the best day ever. And I was like, this is so cool. I want to do this.
That's amazing. That's when you know it's the right, like, career path for you usually, when you're beaming.
Yeah, I was
That's
like,
a good
this
thing.
is amazing.
Wow,
So
wow.
that's what, yeah. And I'm so happy I did it. I'm so happy it's all worked out.
What caught your eye? Was it the autonomy involved? Was it just you have some of the knowledge base, and so you were more comfortable with that type of stuff? Like, what was it?
I think it's just the critical thinking that you get to do. Like, you have this situation in front of you with your patient, and you've got to like quickly, critically think, problem solve, work the problem,
Mm,
go through your own like little diagnosis list and rule out things and kind of settle on something and, treat it and keep the patient safe. I love the satisfaction too that you get from, like solving those problems, but also like when you give a good anesthetic, when you give a good anesthesia and the patient wakes up and they're like smiling and happy and they're just like, I feel great. Like,
yeah,
thank you. And
sure.
they're so appreciative or stuff like that. Like you're just like, yeah.
And so trusted. Like, I definitely, like, besides of course whoever's performing your surgery, your surgeon, but you have to have, it's for a patient to go in and not know anything about anesthesia. Most people have nothing, no clue about anesthesia. And then you're putting all this trust in this one person and you're like, okay, wake me up and hopefully things go well. Like, must be really
I
cool to come to that
know.
other side. So
I know.
that
I can't tell you how many times I have patients that are like, just make sure I wake up. Like, of course you will.
I think it's a natural fear for people. I think maybe it's movies. I don't know if it's movies that like
Yeah.
has that in our head or yeah, I don't know.
You're more likely
So
to get in a car accident, like, than have a serious
it's true.
adverse effect from
Yeah.
anesthesia, like a stroke or a heart attack. Like, you're more likely to get in a car accident.
So that's good statistics to understand for people
Yeah.
and for people to know. So I guess like if you so you're an ICU nurse for a couple of years, you traveled, you're having fun traveling. Was it hard to want to stop the travel nursing in order to go on to the next step? Or you it sounds like you were excited about it, but how did you make that decision with your partner? Like where were you? Because you're traveling at this point. You're like not even
Right.
located in one city.
So like the timeline of things, like I kind of decided, hey, I want to do the CRNA path. This was like 2019. And so I was making all the steps. For whatever reason, I didn't have my CCRN yet. So I got that. And then I don't know why it took me that long to get it, but I did. And then I studied for the GRE so I could get a good score and took past that. And so this is all just before COVID. And then,
Oh yeah.
or no, I applied for school. I did all those things well before COVID and then applied for schools and then got my decision during COVID, like, early COVID 2020. But
It's kind of a process because, like, I don't think
mhm.
people know this, but you don't take the GRE when you go to nursing school. Like, that's not something that is part
No.
of the nursing bachelor's degree, obviously, but it's not something that, like, we study for. Obviously, our
Yeah.
tests are very different.
I think the GRE is pretty similar to what like the SET or what's the other one, the ACT. I think
ACT,
it's like
SAT,
reading, science, maybe science. I can't remember. You
but
had to
for the
write an
graduate level, I
essay.
think, right? Yeah,
Yeah, yeah. There's math,
yeah. Okay. So you had
but
to like kind of plan it out a little bit. So you kind of knew that this was happening, that
mhm.
there was going to be a change. Um, is there anything like, and then how did you even start applying? Like, was it hard to narrow it down? Did you have a
um
couple schools in mind or you were
so
all over the country?
I was.
You're like,
So my husband and I, we were totally open to like any school anywhere, like moving anywhere. Like that wasn't the question. I like somehow I found this document online. I think I paid like $40 for it at the
mhm.
time. And this woman, she's a CRNA. She updates it like every like quarterly or something and updates it, but it was essentially like this massive spreadsheet, like Excel spreadsheet that had a list of all of the schools in the US, including Puerto Rico. And it lists all the schools, it lists all the requirements, like all the class requirements. So like, for example, like I refuse to take organic chemistry. It's just like I'm not taking it. Like that's my one. I'm just if CRNA is in my cards, I'm going to school that doesn't require you to take
Yeah.
organic
Well, you had
chemistry.
the option. Yeah.
Yeah. And that's just like 50% of schools. So like it narrows you down to 50%, but like I still have this humongous list of other schools. So I was like, it's
Mm,
okay. I've got like a long laundry list. And then she also in her in that spreadsheet it says like how many students applied like the last round, how many students got accepted, or like how big their program is essentially, their attrition rate, so like how many students graduated, what's their pass rate, so how many students passed on the first try, passed
the boards,
boards, that
yeah.
is.
Wow.
And then
So everything was on there.
what else did it have? Yeah, and then it had tuition costs too. And so
Oh,
for me
yeah.
the most important things were like tuition costs was semi important. Attrition rate, I wanted a really high attrition rate. There's some schools that like you get in, but like still 50% of their class like fails. It like I want,
50%?
yeah, it's too, this is too much of a commitment. Like you have to quit, nursing your daytime job
Yeah.
in order to go to
It's
school. Like
super expensive. Yeah,
I
it's
want a school that will support me through school because they're confident we're going to graduate and pass boards.
right. Right.
So,
Which is what matters. Like you
yes.
need good experience, good
Yes.
support, and you need to pass your boards.
Yes.
So that's really what matters.
Yeah, so I ruled out those schools that with poor attrition rates, with poor first time pass rates. There's some schools with really poor first time pass rates, and that was important to me because that just shows like your how good they are at how good of a job they do at teaching their students the material that's required to
Right.
in order to
Right.
pass boards. Um,
Was there
and
a big
then
difference? Sorry to like
yeah, yeah, no, there is. Like the school I ultimately chose, University of South Florida. So at the time, they had like a 95% attrition rate. So only, I think they lost like
wow.
one student that year. Um, they had like a 98% pass rate. So like some schools, their pass rates are like 60% or 50%,
Wow.
or
Wow.
a lot of them are really decent, but the bad schools are bad.
Yeah. Yeah, of course. You don't
Yeah.
want to be stuck in one of those. So that totally makes sense that you use that criteria to help you
Mhm.
narrow it down, I assume.
Yeah. Yeah. So, and then ultimately I think I applied to like maybe 3 or 4 schools. um
Is that, like, low in CRNA schools, like, to
I
apply to? I feel like it's hard to
I
conceptualize now,
think
like, how many you should apply to.
at the time, I think that was pretty normal. I mean, we were
Mhm.
really flexible, like with location. So, like some states have a lot of schools, and like if, like for Florida, for example, I think there's about 5 schools, CRNA schools there. And I'm sure like anyone who lives in Florida who's a nurse, like would apply to all those 5 schools.
Right.
You know what I
Right.
mean? Because
Yeah.
you're open to living in any part of Florida
Right.
versus like me, like where they may not like apply to a school in Pennsylvania or Ohio
Right.
or whatever.
Right. And you were
Um,
flexible, so that's helpful too.
yeah, yeah. And I wanted to see how it would go, and I don't know, it ended up working out. I think maybe more students these days, because it's a more competitive atmosphere for applying for a CRNA school. I think students now apply to more schools, which makes, yeah. I don't know though.
Yeah. It's like it's so funny because I another CRNA friend of mine, she was just like chatting about what it's like to prepare for one of her interviews, and it was like literally like rapid fire critical care questions being like thrown at you, and it's so different than the NP process of like applying to school and interviewing or not interviewing and how many steps. It seems like it's because it's super competitive. You have to go through so many steps because they have to have a way to weed out people. If everyone's an ICU nurse working in really level 1 trauma centers and all have CCRNs and all have their CSC certifications, like how the
Yeah.
heck do you choose?
Yeah. Well, yeah, exactly. Yeah. So I got to hand it to them. Have a big. They have those are hard. It's hard to
It's
like
hard.
weed out
Yeah.
the students.
That's true. Did you I feel like looking at that document, I mean, maybe this is poorly on me, but I feel like I would get so depressed looking at like how many students apply, how many get in, like the process of just like your chances. But I guess it is really important to
See,
understand your chances.
yeah, well, that's just it. Like, I really thought so. There's this one school in Spokane, Washington, and I really, really wanted to go there, but the thought I think they have like 12 spots available, and they have
Wow.
well over 120 at the time. This was 5 years ago. 120 people applying to that for
Right.
those 12 spots. I was like, you know what? Like, this isn't worth. It's
You're
no, that's okay.
well, you're flying to an interview most of the
Yeah.
time, then you have
Yes.
to pay for all of that. Yeah, it's like it's a cost.
Well, and you also have to like kind of be realistic about your chances. Like, there are like I had a good resume and I had good scores and good grades and everything, but I also like there was some areas too that like I was lacking, and I was like, you know what, like it's not. I'm just not going to pursue that one. But
Mm,
the school with like the school I ended up going to USF, we had 50 students um, that they accepted in the program, and I think they if I remember that document right, it was like something like 150 students apply.
apply. Yeah.
So that's like one third chance. I
Chance.
don't know.
Yeah.
I thought that was a pretty good shot. And they had
Yeah.
like pretty good statistics. So I was like, may as well
That's great.
try.
Totally.
Like some of that stuff, like you got the math in your favor. So
Right. So besides the of course, you look at the tuition, attrition, test scores coming out of the get go. When you
yeah.
So say you get in, like, I mean, you had to decide obviously what school you want to go to. Obviously, you have to look at location and such. But is there something that you think other students choosing their CRNA school, maybe they got into their top pick, but they're really feeling like a heartstring towards another school? Is there anything that you think students should focus on or ask? Or is there anything that you wish you thought about differently during the
Yes.
process?
I wish I understood how important your clinical experience was. Um,
Hmm.
it I really lucked out with my clinical experience. So it's not that I'm bashing my own. It was the realization that like other students from other schools didn't
Yeah.
have such a superb clinical experience. Like for example, there's a lot of schools, and this is true for NPs too.
Yeah.
You have to
Yep.
travel to other cities across the country to get your
Yep.
clinical hours.
Yep. That you have
And
to find yourself. No one's finding that for
luckily,
you.
luckily CRNA, luckily for CRNA school, they already have these existing contracts.
They should.
And that is such a disservice to nurse practitioners because what a stressful thing you guys have to like
I
freaking figure
know.
out. I don't even know. But like I have, one of my a girl I work with, she did clinicals in Anchorage, Alaska.
Wow.
And there's so many other schools like that where they go to like middle of nowhere, Texas, or they go to the middle of nowhere, Tennessee. I
Even
was
though your
really,
school is somewhere else?
hmm
Oh,
even though your school is in another city, and it's so that you can get like all of your numbers and things, and they get superb clinical experiences in those types of situations, but it's just this added level of stress of being away from your loved ones, having to figure out housing, having to figure
right,
out like transportation, like am I going to drive there, am I going to have to fly back for like these critical events that happen with my school, because you have to like there's events throughout the year that you have to be physically present for.
right.
And like, how are you going
True.
to do that? Like,
Yeah.
can you fly? Like, just all those logistical things. I really lucked out because the school I picked, and another great reason for why I picked it was that all of the clinical sites were all within driving distance of Tampa.
Wow.
The
Nice.
farthest we went was Orlando, and so it's like I don't know. I didn't. I was so lucky to not have to experience that, and I would have never known to ask the question of like, what's the likelihood of me having to like travel far, have to figure out housing or
Right.
stuff like that. Like,
It's an extra cost too. No one's gonna pay
yes,
your mortgage and pay your rental
absolutely,
price. People
absolutely.
don't yeah, that was hard. I know that's definitely a thing for MPs, so it's just disheartening. I mean, I'm happy that they find their spots for them and they still get a good experience, but one thing I think clinical just matters, like your experience matters. It's not even about like obviously having a spot, but it's I also found that it's the experience you have there at the hospital too. Like, do they help you? Do they let you do a lot? How much supervision is it? How much hands-on experience do you get? Like, is that still a thing with CRNAs as well versus MPs? Like,
It all depends on the state you're in and
mm,
then the culture of that like facility.
right. Okay.
So, like, there are plenty of clinical sites where they're like CRNA independent practice, and so you could go into that site as a student. You get to practice like fairly independently with that CRNA, and they'll
Mm,
probably leave you in rooms when you get more advanced, and like what a great learning opportunity for you. And then there's other healthcare systems or just more I guess the facility culture where the it's more anesthesiologist directed, so the doctor directs a lot of the care that the
okay.
CRNAs provide. And there's some hospitals where the culture is that like you have to call the doctor before you go to sleep, you have to call the doctor before you wake up, when you go to sleep for the
Right. Right.
procedure.
Right. 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 Right.
And in some of those places, maybe the doctor is the one who pushes your medications for you.
I see. Okay. So that's important too. Like, you have to think about what kind of
Hmm.
state you want to work in and maybe find a clinical site. Like, you want your school to be in that, maybe in that same city. I mean, you're different,
It's
but
it's so much more like facility culture
okay.
than like there's some states that are more restrictive for CRNAs, but it's very facility culture with the docs and what they do
Got
if
you.
they're like heavily
Okay.
involved or more hands off.
Okay. So anything else you think? So that was a big, I mean, clinical is such a big one. I always tell like at least
Yeah.
MP students that you have to ask what the situation is there. Don't think that it's going to be easy. Like, have a backup plan, have somebody in mind even. So that's good advice for others.
Here I guess what to add, like requirements for CRNAs in order to graduate. I believe it's you have to have 1,700 clinical hours.
Okay. So it's clinical
Um,
hours based.
yeah, and most of us graduated with well over 2,000. And you have to meet so many different numbers. So you have to have so many epidurals that you place, so many spines surgeries, so many, and it even breaks it down into like cervical spine, lumbar spine, thoracic spine
Okay. Okay.
surgeries, so many gallbladder, so many knees, so many hips. We learn regional anesthesia, so that's like the nerve blocks that you get to do. And so you have to have so many like ultrasound, needle guided regional anesthesia experiences. Um, and so you have to beat all your numbers. The hardest numbers are usually your pediatric numbers, and the
Hmm.
your heart numbers can be some of the trickier ones. So,
Huh. Well, I think, it's so funny because I know we've talked a lot about this just anecdotally on our own. Just it seems
hmm
you guys come out so well prepared where you feel confident, very confident going into your first job versus I feel like MPs feel very differently when they come in, like a family nurse practitioner or an adult gero NP going into practice. It is, I think, it's totally different schooling too. One's a master's degree, usually one's a doctorate degree. So it's like, did you feel well, I know you felt prepared. So can you speak a little bit to like deciding, like going
yeah,
into your first job? What was that like? Was that scary? Were you prepared? Yeah, tell me what your thoughts are on that. Or like, what could you do for other CRNAs when they're preparing?
I felt I felt extremely well prepared. I
Good.
felt I felt like the last like 6 months of my clinical experience when I was in school, I was like so over it, so over like the opinions of my CRNA. Not that I knew it all, but just that like I got this, like it's okay.
You felt
And
confident.
I just felt really confident and comfortable and with everything. So there was that. But no, I uh my first job, now is I didn't do clinicals. Like I came in a lot of people, like, they'll take jobs, like, where they've done clinicals at, because 'cause they're familiar with it and they know, and it's
Totally.
already the area they wanna live in, blah, 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 blah. Lots of reasons why. But I picked a job that I'd never done clinicals with, and so, there was anxiety there about, like, where are things? How does this work?
Right.
What's the flow? Like, who
Right.
does the pre-op? Like, do I have to put in orders? Like,
Right.
just the little minutia things of that. And they gave me a week of orientation to, like, get a handle of, like, okay, like, here's where our EP lab is. Here's where, like, this is our surgery outpatient surgery center is. This is, just
Get
different
the
days in
jitters
different
out.
areas. Yeah, like, here you can have a day, like, doing MRI sedation, like, stuff like that, just, like, in different out of OR experiences, so that way you get
Yeah.
familiar with
The
it
system,
all.
everything.
And so that was really helpful. And, I asked a lot of questions about flow and things, and texted people like, what is this doctor like? Like, is this
Yeah.
okay? Do I
Right.
need to paralyze, or is, like, kind of whatever?
Well,
Um,
people there's so many ins and outs, right? And then it's not
yeah,
always, especially if you're working in a state where you're working collaboratively with other providers, anesthesia providers or anesthesiologists, there is a little bit of that going on. And so that can be anxiety driven if you don't know the team even, or
right,
you're
right.
moving cross country too
Yeah.
on top of that. So
I was so
yeah.
lucky with such welcoming coworkers who are just, like, the nicest humans ever. And we're all like, just text me for anything. Like, seriously, it can be anything. If like, I will never judge you by your stupid text.
Yeah.
Like,
Well, that's a great
and
environment. That's
so
very
it's
supportive.
so nice. Yeah, I felt really safe to ask, like, silly questions. Um,
Totally. Did you have to
yeah,
transfer your license per se? It's all like still nursing
yeah,
license stuff, right?
yes.
Like
Is
you
that the
apply
same
by
for
the state.
NP? Like, you have to
Yes.
switch your RN first, and then you can switch your APRN to another state?
Oh, that's a good question. I think you need your RN in the state first, and then you can get your APRN. I
Okay.
think you're right on that
Yeah.
because I had, yeah, mine was Hawaii, and I already had my RN, so that's why. But yeah, you have to have both. You can't just have an APRN license. You have to have both an RN and an
Yes.
APR, which I get. But then you're renewing them at different times, and yeah, it just gets complicated
Yep.
sometimes. But
I know, it's hard to keep track of it all.
I
You
wasn't
rely on
sure.
all the emails.
Yes, or the little poster cards that they send to you.
Yeah,
So
you're like, "Oh, shoot, I better figure out my CEs."
Yes, CEs, and that is, I don't know what it's like for you, but I know for me, because I'm like, if you have 2 certifications, I have to have CEs that are totally different for both of them, and
Oh, is there
some
no
don't all
overlap? That stinks.
I mean, they do allow some, but some like, my women's
Yeah.
health is very particular about what they want or where you get your CEs from, so
Yeah.
it's well, it's all relative to your situation, I guess. Can you talk a little bit about, like, your process of looking for a job once you got, just how is there anything that you would the CRNA process? I know MPs, so we talk a lot of like MPs talk a lot about this. Like when you graduate, depending on where you are, it can be very saturated. I hate that word because I really believe that if you have good experience, solid skills, you have, I mean, it's not true for everybody. It can take some time to find a job in certain states more so than others. How do you feel like it? Was it hard to get a job? Was it easy to apply to jobs? What was the process like for interviewing? Like, what was your process like for your CRNA interview? Was it scary? Was it okay?
Let's see. So, I only applied to the job I'm at officially, I guess. I was offered jobs at all of the clinical sites when I was a student. They're like, "We'll hire you if you want." I'm like, "I don't know, it
They're like,
might
why?
be." Maybe, I don't know what I'm gonna do yet. Is what I'd always say. But no, you CRNA is such a needed profession.
Hmm.
We're in high
Yeah.
demand, so you really have, like, a lot of job options. The job opportunities are more, um, the jobs that are harder to get as a CRNA would be, like, the ones, like, in the eye clinic, because they've got a great
Right.
schedule.
Right. Right.
Or,
Right.
like,
Right.
like, the IVF, like, fertility clinic, like, Like those are really hard jobs to get.
Right, right. Very specific.
You have to have like a really special in, but otherwise like hospital jobs, like they're always hiring for the most part.
Okay. Okay. Got you.
It would be really, really rare that you'd find where they're like, oh, we're not really hiring. We have enough. So anyways, the interview process, it was they asked me for, my numbers, like what I'd completed so far in clinical. And then I know that like once you've already been practicing for a long time, you can get those numbers because they'll ask for them again. They'll ask you for case counts.
Oh. Okay.
And so in case counts, like it'll say like how many patients you've cared for, like what kind of procedures, if you've done spines, OB,
Okay.
what have you, nips, hips, knees, like laparoscopic, like whatever. It'll count it all up into like you can get that kind of stuff from your billing department. They use like the Epic,
Okay.
some kind of tool in
In
Epic to get that.
Is it hard to get credentialed? Like, how long is the process? Because that can take, I know for
Really
NPs, that can be
long. They
time consuming.
like minimum, they always say like 8 weeks minimum, but usually
Okay.
it's like at least 3 months, maybe
Yeah.
longer.
Yeah.
It's a really time consuming because you have to like they like present your paperwork to their board and they approve you 2 different times, and then they have to do all the background checks on your credentials, your
Right.
schooling, your whatever is in your background. They
Right.
double check it all, call your references. It's like a really thorough
Which is good.
history,
That's how it should
which is
be. It
really
should
good.
it should be
And they,
that
they do
way.
this for all like really advanced practitioners. So
Just
it's
takes a
not like
while.
unique for us.
Yeah.
It's for
Yeah.
physicians, for APRNs, for everybody,
Everyone.
PAs. But and then you do a site visit before that, before it gets that far. Um, Meet the staff, ask questions, try and get some phone numbers so you can talk to them.
Yes.
Um, a bit
Outside
more
of that
one on
setting.
one to get more of the inside scoop of how things are actually done there and things like that. Um, and then when you're like officially like, yes, I want to work here, sign the contract. That's when they do all the credentialing and all the things.
So is it
But
everything you thought it was going to be, being a
it's
CRNA?
great. I love
It's
it.
great.
I do.
Good.
I'm so happy I made the switch. It's great. It's a lot of fun every day. Just
How long was the process total, would you say? From applying to day
let's
one on the
see.
job?
Oh, I guess like 4 5 years.
5 years. Wow.
I
4 or 5
applied,
years.
and like just before COVID, so you could say like December, January 2020. And then
Okay.
yeah,
Yeah. So
started
it
this
takes time.
August.
Totally.
Mm-hmm.
That's crazy. And I guess lastly, I'd love to close out just with some advice. I know you had mentioned at some point, I believe, during the application process, like there are these like CRNA advocates that advocate your
Yes.
application for you. Can you talk a little bit about that? Because
Okay.
I might not understand that, but other CRNAs might
They're
understand.
all over Instagram. It's these companies, that these they're created by these CRNAs who create companies that they'll review your resume. I'm so sorry if you hear my dog.
Hi, Kona.
He wants to play. um, CRNA companies, and so they'll for a fee. It's a fee for service. So they'll help you improve your resume. They'll help you improve your application. They'll say like, hey, I think you'd really benefit from retaking this science course or doing this kind of course. Or
And this is
redoing
to
your
apply to
GRE.
school,
Yes,
just
correct.
to get into school. Okay.
And
Okay.
then they'll say you've got like a essay to write for the school. They'll review your essay for you.
Wow.
Maybe they'll help you with interview prep. These are all different services that they charge individual fees for, like thousands of dollars for. And
Wow.
I mean, like, I'm not gonna lie, like they probably get like help a lot of these students, that may not have been able to do it on their own. But I think I don't know. I think you should be using the CRNAs around you. Like like
Yeah.
if you know you're going to stay in Florida
Right.
or like working in that area, like shadow a CRNA and find a mentor that can like help you through the process. Or say if that person is too far removed from school, but they've got another colleague who just graduated, like that person's perfect for helping you get into school. And they're not going to charge you several $1,000s.
Yeah.
And they're
Yeah.
gonna help you, and they're gonna help you like really pinpoint like you know the different interview techniques of like how to answer things a little bit better in a more educated way, like what to really focus on, how to pass with flying colors, some of the like personality interview style questions that they
Mm.
do. Like I just think you're gonna get a lot more out of it with someone who's personal like that and actually putting in more of the work yourself. Not that those other
Yes.
people don't deserve it, but I feel like sometimes, like, I don't know, you just kind of worry with how competitive it is. Like, are those people writing those essays for
Yeah.
them? Like, is it really
Yeah.
fair? Like, I don't
True.
know. This is such you need to be, you need to be smart enough to get through school. So, like, you shouldn't be having all this extra help, I guess, if that makes sense.
No,
I
it
don't know,
does.
that's
And
my own philosophy. People
yeah.
could disagree with me, but that's where I stand.
Yeah, I mean, I guess you could say like like do whatever makes your application the strongest, but I see your understanding. My understanding is too. You want to feel confident in yourself enough. You want to feel good about what you write. You want to just present yourself in a way that is confident and, especially I bet there's a trend. Okay, this resume is like this typical resume as everyone else. So,
Right.
um interesting to hear your perspective on that. Do you know a lot of students that did that? or is it that like a newer thing after 4 years in you're seeing it
It's a
more?
newer thing. I feel like it really exploded like while I was in school. Or maybe I just started following all these CRNA
Yeah.
accounts while I was in school and like
While you're in school. Yeah,
learning about that.
totally,
But
totally.
yeah.
Well, thanks
Um
so much for sharing your knowledge. Like, I think this was really great help for anybody who's interested in becoming a CRNA, or I think we could have a whole nother episode on travel nursing, which we'll probably do in the future one day.
yeah.
Um, so thanks so much for coming on, and I really appreciate it. And I know Kona, your dog, was so patient, so he deserves a deserves a treat afterwards.
Oh, yes.
So thanks so much,
This
and
is
hopefully we
fun.
see
Thanks,
you
Megan.
soon.
I
Yeah,
know. Thank
anytime.
you. Anytime. Okay.
Thanks.